Hello, my name is Patricia Vlasman. I am 45 years old and live in Amsterdam, in the Netherlands. I'm the writer of the book Open Hearted, My Life with Cardiomyopathy and Heart Failure. This one. I have a hypertrophic cardiomyopathy, and since the last 10 years I suffer from arrhythmias. To treat arrhythmias, you can get medications. Mostly they begin with a beta blocker like metoprolol or specific anti-arrhythmic drugs such as sotalol or amiodarone. They can also give you some calcium channel blockers like verapamil. So I take all these medications. Still, I suffer from the arrhythmias. I underwent ablations, but also a lot of cardioversions. And today I want to make this short video about the procedure of a cardioversion, because I can imagine that it may look and may seem very frightening. I underwent over 80 cardioversions in the last few years, so I just want to give you a little insight of how it goes as a patient. So I live in Holland, so when you are here in the Netherlands and you have to go to the hospital to have a cardioversion to stop the irregular heartbeat, the procedure will be done by a cardiologist and an anesthesiologist. Well, I just go through it as I have to do it right now. When I have this fluttering feeling in my chest or a very fast heart rhythm, then I go to the hospital, and the cardiologist will inform the anesthesiologist to perform an ICV. First thing they do is give you a IV in your arm or in your hand when you're not really when your veins are not really smooth to catch. They put an IV in and they put the wires on from the electrocardiogram. Then you lay down in the bed and you get an oxygen mask on your face, and they put huge patches on your body which are connected with the crash car, and the crash car gives you the shocks. Well, these huge patches, there are two of them. Most likely they will put two on front, but when you're an ICD pacemaker carrier like I am, they always put one on your back, so one in front and one on the back. Well, then with the oxygen mask on and the patches and the wires from the electrocardiogram, and also they measure your oxygen, the anesthesiologist will put some propofol in your IV. Propofol is a unique thing because that will bring you to sleep, and that's the best part of it. You won't notice anything of the cardioversion at all. So when you are feeling afraid or anxious, don't be, because you are in a comfort, far away sleep, and during that short period, the cardiologist will give you the shocks with the crash car. In Holland, they mostly begin with 100 joules, and they can charge that up until 360. Well, after that, I think most time is with the with all the wiring and putting everything on, but the shocks itself is just like maybe 1 or 2 minute work, and after that you wake up and you have this really good feeling of sinus rhythm again, and that is such a relief. Well, everybody who suffers from arrhythmias knows that. So my message today about Electrocardioversion is, please don't be afraid of it. It doesn't hurt at all. Don't get confused by all the people around you. I mean, the nurses and the cardiologists and the anesthesiologists. Just lay down, let the propofol put you into sleep, and wake up fully with a very relaxed and nice rhythm. Well, I hope I have informed you a little bit about this procedure, and if you have to undergo a cardioversion, good luck and don't be afraid. Bye bye.